Wow, this is actually exciting and educating, and I'm so happy that after this section I can boldly walk up to someone and tell the person about diabetes mellitus. Okay, Dr. Ogumka, please, can we know how to manage this disease condition?
Okay, in terms of the management, like I mentioned earlier, diabetes mellitus is a chronic disease, meaning it doesn't occur within a twinkle of an eye. It takes years to develop.
Wow.
So, meaning in the course of its development, there will be a lot of complications. So, in the management, you want to reduce those complications.
Okay.
So, whatever management decision you're making, you want to target those complications to make sure that you reduce them. So first is lifestyle modifications. So I talked about people who are obese being prone to developing diabetes mellitus. So you want to tell them to lose weight because it's very necessary. Now, when they lose weight, they intend to gain two things. One, they reduce their risk of developing diabetic complications, and they will also reduce their blood pressure in the process.
Okay.
So before you start any medication, you have to start with what we call non-pharmacological therapy. So that is where lifestyle modification comes in.
Okay.
We will also talk about diet modification. So you want to ask the patient, well, how is your diet? So you change diet for the patient. So in managing a diabetic patient, it's a multidisciplinary management, meaning it's not only a doctor who does the work. You have to involve the nurses, the pharmacists, and also the nutritionist. So you people would put your heads together, and it's also patient-centered. So what you do for one particular patient, you are not expected in most cases to repeat it because the stages are different,
okay,
and the risk factors as well. So you have to involve other professionals in the management of this. So for example, if you're talking about diet modification, you have to involve the dietitian who do a meal plan for the patient. Then moving on, if the patient have already developed complications, you have to, as I mentioned earlier, know already at this point what type of diabetes you're dealing with. So if you're dealing with type 1 diabetes, of course the patient will need insulin. Or if you're dealing with type 2, of course you have to know if you start the patient with drugs or you're combining it with drugs and insulin. Because most times in emergency cases, there are patients, they rush into the hospital and their blood sugar is really high. That at that point, using drugs will not be effective. So you have to start with insulin, and at some point you will now introduce drugs. So that's how. So it's patient-centered, and you have to do a lot of workups before you can arrive to your management decision. So like I said, you can use drugs, you can also use insulin depending on the type of diabetes you're looking at and depending on the sugar level as well.
Okay.
So if it's an emergency case, you have to start with insulin, and it's not something you should also try at home. You have to ensure that you see a doctor, because if you see a doctor would help in the management, proper management of the patient. It's not something you walk to the chemist and ask them to give you drugs. So you have to see a doctor for proper evaluation and diagnosis before you now proceed to appropriate management. Thank you.
Wow, that's really interesting. So you heard Dr. Ogumka, don't go buying drugs at one chemist or one pharmacy without the doctor's order or permission. Okay, Dr. Ogumka, when you were explaining the management process, you talked about complications. Please, can we know the complications of this disease condition?
Okay. there are a lot of complications from diabetes mellitus. We have what we call microvascular, we have macrovascular complications, so, but they can also be grouped into systems. So we have the one we call retinopathy, so it has to do with the eyes, and at some point if the sugar level is really high and uncontrollable, the patient, it could lead to blindness. That's the simple term. It could lead to blindness. It could also lead to what we call nephropathy. There will be injury in the kidney, that the kidney won't function normally anymore. So to the extent that the kidney, the patient will begin to urinate, there will be protein and sugar in the urine. So at that point, you know that there is already damage in the kidney. Then there is also what we call neuropathy. So it has to do with the brain and the neurons.
Okay.
So then there is what we call the peripheral neuropathy. So the patient can step on a sharp object and will not feel any pain.
Wow.
So those are some of the complications. Then we'll also have what we call a foot ulcer. So that is where what I talked about earlier comes in. So a patient begins to develop maybe had one injury that refused to heal, and from there it spreads and becomes an ulcer. So the patient will tell you, in my experience, they will usually tell me, Oga, I step juju, I match juju, the way they do for me. But in most cases, it's not that I'm denying the fact that there are no juju or that people don't step on top of juju, as the case may be. But in most of the cases, such foot ulcers are as a result of a complication of diabetes or uncontrolled sugar level. And when you request for blood sugar, the result comes back, the blood sugar is usually high. So at that point, you want to deal with, like I mentioned in the management. So if you're managing a patient, you have to look at what are the complications that the patient have already developed. So that will now help you to know how to manage. So people who have developed retinopathy or nephropathy, problem of the eyes or the kidney. So your target is what we call glycemic control. So you want to reduce the sugar level to a certain level that would make all these complications to begin to diminish instead of escalating more. So your target is glycemic control. So you bring down the sugar level to a minimal level. Then there are already those that have developed ulcers already. So at that point, you want to salvage the spread of the ulcer. So that is where amputation comes in, because there are patients that have been amputated from diabetic complication. Of course, they didn't know that they had diabetes.
Wow.
And before they discovered, it was already late to salvage their food. So you have to do amputation for such patients. So there is also, as I mentioned earlier, the macrovascular. So it has to do with cardiovascular diseases. What that means is diseases that involves the heart. So the patient develops hypertension, and of course from hypertension the patient will also develop kidney problem. So they are intertwined. So if a patient has diabetes and is uncontrolled, there is possibility that that patient will develop hypertension. So, and if a patient is also hypertensive, there is a possibility, like I mentioned earlier, one of the risk factors is blood pressure of 190 and above. It's not that all patients that are hypertensive will develop diabetes. No.
Okay.
So there has to be a family history, of course, like I also mentioned
earlier. Okay. Wow. You've heard it all. Once you have that complication, you head straight to the hospital. You don't even have to wait to have this complication. You can just start by checking your sugar level after this show. Thank you, doctor, for educating us. But we know we can actually prevent this disease from hitting and then getting to the stage where we say we have complications. So what are the preventive measures we can actually take to make sure that it doesn't get to that point where we have these complications you just talked about?
Okay. There are several ways to prevent it, but when it's already in the family history, so you have to modify your lifestyle to the extent that you delay manifestation,
okay,
you delay complication. So of course, as I mentioned earlier, lifestyle modification will prevent so many diseases, including diabetes.
Okay.
First is you have to ask, what is diabetes or hypertension in my family? Does my mom, my grandma, my granddad, my dad, do they have diabetes or do they have hypertension? So you need to make that investigation. So when you discover that there is family history of diabetes in your family, you have to say, okay, now there is a family history, so what do I do? So you avoid certain lifestyle, you also avoid certain food that trigger your sugar level, then lifestyle that doesn't allow you exercise. So you have to put exercise into your schedule, make it one of the important schedule or activities that you should pursue. So of course, regular exercise, then your diet is also one of the ways you can prevent it. Then two is, of course, that falls into what we call primary prevention. So primary prevention is you're preventing it before it even comes. So you are chasing it away. Then if it's already there, you have developed it already. So you now begin to aim at secondary prevention. So secondary prevention, you are going to focus on making sure that you don't develop those complications I talked about. So you ensure that you take your drugs adequately. You go back for your checkup when your doctor says you should come back. You monitor your sugar level regularly and you report to your doctor. Because from my experience, when a diabetic patient or hypertensive patient comes, I usually tell them, get a notebook, monitor your sugar level regularly, you record it, and when you go back for your visit, including your blood pressure, record it. When you go back to your visit, you should be able to show your doctor. Doctor says, this is my sugar level and my blood pressure. Okay. So your doctor looks at it and it gives the doctor an idea whether you're doing well with the medication he or she placed you on the last time. So if you're actually doing well, the doctor will adjust it, maybe lower the dose.
Okay.
If you're not doing well, it will also increase the dose. But a situation where you come to the hospital, a doctor makes prescription for you, tells you to monitor your sugar level and blood pressure even while at home, then come back in 2 weeks. You don't come back. You stop that particular medication, finishes, you don't go back, you don't, or you go and buy the same drugs without speaking to your doctor. It's damaging. So the right thing to do is you go back to see your doctor for a follow-up. So your doctor evaluates your result, your symptoms that you presented with initially, and will say, okay, you're doing well with this, maybe you should continue again for the next 2 weeks or 1 month, or you're already done well, so let's reduce the dose, or you're not doing well at all, so we need to switch medication. So these are the things that actually would make a patient not develop serious complications. So, but ignorance will not allow patients to actually take these things seriously. So they go back to, after they see the doctor because they were really sick, so they go back, they feel they are okay, so they stop. So over time they will develop complications. Then tertiary prevention has to do with the complications already there, so we prevent it from getting really worse. So that's tertiary prevention. So of course I talked about food ulcer. So one of the tertiary prevention is you don't want that ulcer to spread. So you want to do amputation for your patient. Okay. That's tertiary prevention of further complications.
Wow. It's been an interesting and educative section with you, Dr. Ogunka, I must confess. But I have this last question. Though it's funny, but I hear people say, don't take alcohol. Excessive intake of alcohol may lead to diabetes. What do you have to say about that?
Yes, it's true because, of course, the byproduct of alcoholic metabolism is fat.
Okay.
So then, of course, most times to alcoholic contents will also the after metabolism it results to sugar as well. So remember I said that when the sugar level is high, the insulin is not able to regulate or reduce it, and there will be a problem. So alcohol consumption, especially for somebody that has a family history of diabetes, is a no-no, especially when the person is used to excessive consumption. Now, alcohol consumption also would result to this factor for hypertension as well. So one of the lifestyle modification that a patient who is prone to developing diabetes and is also an alcoholic person is to quit alcohol, quit smoking as well, because those are things that will result to diabetes mellitus and of course hypertension. Then there is also what we call dyslipidemia, so increased triglyceride and cholesterol in the blood. So those ones, like I earlier said, they have connections. So if it's not properly regulated, patients is likely to develop some of these complications and they drag each other along. So at some point, like I mentioned, the age of 40 and above. So as we age, it's good to slow down and take a risk assessment.
Whoa.
What you need to actually avoid at least when you hit 40, there are certain things that you should start avoiding because of complications or developing of certain diseases.
Wow. Paul, I'm having a great time. It's like this section shouldn't come to an end, but it has to come to an end at this point. And I'm so happy you graced us with your presence, Dr. Chime Ogunka. And to you, my great audience, you've heard it all. And I'm so happy having you on this show. It's Ama's Voice, and I am your host, Christian Victory Shamaka. See you next time on Health Corner or any other corner at all. Thank you.